How does intersectionality impact mental health outcomes for queer youth? How does intersectionality impact mental health outcomes for queer youth? This question opens up a conversation about the many layers of identity that shape experiences. Intersectionality looks at how different parts of a person's identity, like race, gender, sexual orientation, and socioeconomic status, overlap and influence their lives. For queer youth, this means their mental health is affected by both their LGBTQ+ identity and other social factors. Research shows that queer youth often experience higher rates of depression, anxiety, self-harm, and suicidal thoughts compared to their peers who are cisgender and heterosexual. When we consider intersectionality, these mental health issues can worsen due to additional challenges like racism, ableism, or financial struggles. For instance, LGBTQ+ youth of color frequently report poorer mental health than their white counterparts. They face the dual burden of racial discrimination and LGBTQ+ stigma, which can create a more challenging environment for their mental well-being. An intersectional approach to mental health acknowledges these overlapping struggles. It calls for support systems that consider the full range of identities and experiences that queer youth navigate. This approach respects young people's autonomy and views them as experts in their own lives. This can help reduce feelings of isolation and stigma that many queer youth face. Creating affirming environments at home, in schools, and within communities is essential. These spaces should recognize and validate all aspects of a young person's identity. Family support is vital for mental health outcomes. Queer youth who feel accepted by their families tend to have lower rates of suicidal thoughts and attempts. Schools and communities that affirm LGBTQ+ identities also contribute to better mental health by reducing bullying and discrimination. For LGBTQ+ parenting and family dynamics, this means parents and caregivers should educate themselves about the various identities their children may hold. Understanding how these identities impact mental health is key. Families can create safe spaces where children feel free to express themselves without fear of judgment. Open communication and validation of experiences related to race, gender, and sexuality can support resilience and well-being. Advocating for inclusive policies and supportive environments in schools and communities can further protect queer youth from compounded discrimination. Overall, intersectionality shapes the unique challenges queer youth face regarding their mental health. Addressing these challenges requires support that honors the complexity of their identities and prioritizes their dignity and agency.